Hi, everyone. My name is Charlene Payne, and I am a social worker with Mental Health and Addiction Services with Western Health in Corner Brook. My position is the Regional Mental Health and Addictions Coordinator, and in this position, it is my responsibility to provide education and awareness in the community around any topic related to mental health or substance use. So I would like to thank you all for joining in the session today. Today's session, I will be talking about some e-mental health services. More specifically, I guess, I will talk a little bit about some of the various online programs and resources that are available to individuals. So let's get ready to begin, and I will get ready to share my screen with you. Okay. So like I said, we will talk a little bit about some e-mental health and online programs and resources available. There. It was a little slow starting for me. Okay. In today's session, I will provide you with some information on various programs, supports, and resources that are available for individuals and families who may be struggling with alcohol, substance use, or gambling. The focus today will be in particular on the various online programs, e-mental health services, as well as some other supports available. So looking at some different community groups or organizations that you can connect with that provide support. And I will also provide you with some crisis and helpline numbers. Because again, as I mentioned in a previous session on mental health and addiction services, there are so many supports and resources available out there. So it's important to have these types of sessions to let people know what is available to them and how to access those services if needed. So just to highlight what e-mental health is, essentially e-mental health is providing services in a different way than the traditional in-person contact. We have a wide variety and range of e-mental health services that are free and available to all individuals of Newfoundland and Labrador. So no matter where you live in the province, you can access services. Some of these services may be focused on youth or adults or for both. There are several e-mental health options available to you and your friends or family members. The options includes some self-directed learning, information, and activities. Some are focused on crisis intervention or counseling services. So why do we use technology for mental health and addiction services? Essentially, it gives people more options and more improved access to services. So again, no matter where you live, people have more choices and have more control over how to access information and how to access support. E-mental health, however, is not meant to replace in-person contact. We still encourage face-to-face services if needed or necessary or preferred. But, you know, e-mental health just gives people that different perspective and additional options. It also provides opportunities for you to take care of your mental health and to stay well. So it's, again, about taking control over our own health and wellness. Many services within mental health and addictions services are provided by telephone or virtually, as well as in person. So you can access many of our groups and services in the comfort of your own home. I want to talk a little bit about bridgethegap.ca. Is our online mental health and addictions resource which instantly connects people to self-help information as well as local supports. It was developed by the Newfoundland and Labrador provincial government to help people support their own mental wellness. Since the pandemic, Bridge the Gap has expanded to Atlantic Canada as well as Canada. So now if you were, the home screen looks a little bit different than this picture. I apologize for not having it updated. If you go to Bridge the Gap now, you'll be prompted to enter your location. So if you want information from Newfoundland and Labrador, you just select your region, and then it will link you to resources within our province. You can use this website to access information on a number of mental health and substance use topics that provide either advice or inspiration or direction for finding additional supports when you need it the most. So there are sections for youth, and another section is specifically for adults. Essentially, both sections offer the same resources and information. It's just looks a little bit different, and some of the wording is different, and some services for youth are specific as well. So there is that difference also. However, in both sections, there's a service directory. So you can, if you're in Western Newfoundland or Eastern or Labrador Grenfell region or Central region, you can find information on local resources and supports, community groups and organizations that can provide support. There's also a knowledge center. So anything, if you're looking for information specifically on stress management, for example, you can find information on stress in that section under Knowledge Center. There's also a section called Get Inspired, or in the youth section, it's called My Space. So this is an opportunity for people to share stories, or if they found a particular book really helpful, they can share that with other people. It could be art or writings, poetry, or quotes. So there's an opportunity for you to share your stories or experiences, what works for you, and so on. There's also another section on Bridge the Gap called Online Programs. So under this section is where you will find a number of connections and links to a variety of online programs and supports. I will be talking about a number of these shortly. So that's where you will find information on the ones I will talk about under the online programs section. Also under online programs, you will find links and access to a wellness series or wellness sessions. This is where you will find recorded webinars, presentations that you can view. There's also another section on Bridge the Gap website called your toolbox. And the toolbox provides you with links to various apps or games, activities, relaxation exercises, breathing exercises, mindfulness activities. So a number of tools that you can use to help you on a day-to-day basis. So that's essentially bridgethegap.ca. So Bridge the Gap with 2 P's.ca. Anything you need to know about mental health and addictions in our province. I encourage you all to have a look. We also have an online screening program called checkitoutnl.ca. So checkitoutnl.ca have a wide variety of online screening tools that you can take anytime and anywhere. So it's taking that important first step, you know, to check in on your wellness and well-being and see, how am I doing really? There are many screenings on an overall well-being, depression, anxiety, alcohol use, substance use, post-traumatic stress, eating disorders, bipolar disorder, psychosis, adolescent depression, and that's one parents can complete, opioid use or gambling. So there's a number of screening tools that you can take. So They are very fast, easy to complete, and completely anonymous. They are available for adults who are age 18 and older. So how it works is that you select a screening tool based on how you have been feeling lately, and you answer the questions, and you will get some immediate feedback and results. It will not give you a diagnosis, so they are not diagnostic tools, but they will give you some recommendations and results in terms of, okay, what are some next steps, and link you with some resources and local supports and services available. So you can go directly to checkitoutnl.ca, or you can also access it through Bridge the Gap website as well. We also have a provincial mental health and addictions systems navigator. So this position is dedicated as a central point of contact for people, family members, and stakeholders or community groups throughout the province. The purpose of this position is to help people problem solve and figure out, where do I go next? What are my next steps? We'll help you discuss options and find the right mental health or addiction services that will help meet your needs. And will also help in making connections in your area. So currently, the position is held by Barry Hewitt in Eastern Health, and his contact information is here as well. So again, this is a provincial-based service. Anyone in the province can access. Therapy assistance online. Often we refer to this as TAO. So there are two ways that you can access TAO, or therapy assistance, online. This program combines online education materials with brief contact with a counselor. You do this either through phone or through video to help you track your progress. So TAO with a counselor is where you complete online modules on your own time in the comfort of your own home, but you still connect with a counselor to check in on your progress and help you improve your health and wellness. You can also access the TAO Self-Help Library. And this library includes interactive education modules and practice tools, resources, and information on a variety of topics related to mental health or substance use. So usually, you can do things on your own time and at your own pace. And, so it can be brief. You can do a session that might take only, 10 to 20 minutes. And even your sessions with your counselor can be very brief as well. Again, you can visit bridgethegap.ca for more information on this program, or your local mental health and addictions services office. There is also a well-being course that is an interactive online course available at wellcentral.ca. So it's www.wellcentral.ca. And this program is for anyone who wants to improve and protect their mental health and well-being. Also, if you are dealing with stress, anxiety, low mood, or other life challenges, and if you would like to enhance your mental health and well-being. So it's, again, a self-paced course that has 8 modules, and each module takes about 30 minutes or less to complete. It guides you through 6 areas of well-being. So looking at our physical well-being, our social, our emotional, our cognitive, meaning and purpose, and our environmental well-being. So all areas of a person's life. It is done with people who have lived experience of mental health and addictions challenges as well. Again, you can access further information on Bridge the Gap for this program. Mindwell U offers an online mindfulness training program. And this program is proven to improve mental wellness, resiliency, and performance. So this is where you can take the 30-day mindfulness challenge that maybe you've heard about. And if you haven't, then it's really simple. You can sign up to take the 30-day mindfulness challenge. It really only takes about 5 to 10 minutes per day. You can always invite friends or your family members to join along and make it, a fun group activity to do, little competition maybe. So again, you can access any of these programs from either computer, your tablet, your phone, and this one is available in English or French as well. Breathing Room is another online program for youth and young adults who want to learn new ways of managing symptoms of stress, anxiety, and depression. Through videos, stories, and activities, the interactive experience offers fresh ideas and tools to help you move forward. The program does involve 8 online modules, which includes fresh insights from a medical expert that have helped others move forward, an engaging program host who guides you through the program and shares personal experiences, simple offline activities that you can try out, the different activities that were presented and ideas, the use of music that expresses emotions that we can all relate to, movie and book suggestions, true stories written by others who have dealt with a tough situation, and also jokes and humor to help lighten the mood. So they also use visualizations to help you relax and take a break from the pressures of life. This program was initially developed in Alberta. Breaking Free is an online self-help program that you can access 24 hours a day, 7 days a week on any device again. So it is proven to be effective at helping people cut down on their drinking or drug use or to quit completely. This program is totally confidential and there's no waiting time, so you can immediately start working towards your personal goals. It is free for all residents of Newfoundland and Labrador who are age 16 and older. It's easy, safe, and it's also available in English and French. Wellness Together Canada was funded by the Government of Canada in response to the unprecedented rise in mental health distress due to the COVID-19 pandemic. People are being challenged like never before due to isolation, physical health concerns, substance use concerns, financial and employment uncertainty, and the emotional dialogue around racial inequality. We're all going through this together, and we believe that mental health is a journey and not a destination. Each day we can take a step for our own well-being. Wellness Together Canada is here to support everyone on that journey. We all have different needs. So Wellness Together Canada allows you to choose from a variety of resources to motivate and support your wellness journey. So we can take a step for our own well-being journey. The Strongest Families Institute provides telephone and online options for youth ages 3 to 17 and their families who are experiencing behavioral or mental health issues. It supports youth for mild to moderate anxiety and behavioral problems over 12-week programs or courses. So one is for behavioral concerns, anxiety issues, or bedwetting issues. So really the benefits of this program is that it strengthens coping skills in families, improves parental mood and stress, and increases accessibility. Because again, this program is done in the comfort of the family's own home, but you are connected with a telephone and online coaching to help you along your own program. So this program, the Strongest Families Institute, is based out of Nova Scotia, but they do provide services to families in Newfoundland and Labrador. So again, you can access information on Bridge the Gap around this program. Excuse me. They also have another program from the Strongest Families Institute called Parents Empowering Kids. So looking specifically at the early years. So this provides online or telephone program for parents of children aged 3 to 6. So it's for parents who are interested in learning about positive parenting skills. And again, it's a free program for all Newfoundland and Labrador residents. The Strongest Families Institute also provides a program called I Can, and it's I Can Conquer Anxiety and Nervousness. This supports young adults 18 years and older. It's not limited to 30 years of age now. Since the pandemic, it's anyone 18 years and older. Basically, this program helps support young adults in learning life skills to overcome anxiety and cope with major life stressors. The program offers distance telephone or online coaching, and again is free to all residents of Newfoundland and Labrador. So you can either contact the Strongest Families Institute directly or visiting bridgethegap.ca. All right, so that was mostly an overview of the various online programs and services that are available, again, through bridgethegap.ca. But I do want to take a few moments and talk about some other supports that are available to individuals. There are different types of support. You know, we don't always have to do everything on our own. There's always someone out there that can help. So they're looking at different types of support. There's emotional support. So who can you talk to about things? Who can you talk to about, you know, what's going on with you and how you're feeling? There's also moral support. So someone who provides you with a sense of encouragement. So if you're feeling down or you're feeling stuck, who's your go-to person to give you that little nudge of encouragement? A mentor is someone who provides you with a sense of guidance or a sense of instruction. You can also look for instrumental support. So someone who is going to help with practical things like homework or transportation or childcare or housework. Basic day-to-day help with things. Also companionship, someone who or something that's going to give you a sense of belonging. So that could even be companionship from a pet, right? Or a loved one. And informational support. So who are you going to go or where are you going to go to find accurate, up-to-date information and facts? So looking at these different types of support can be very helpful as well. And who would you, who would you go to for professional help? Again, you know, we don't have to do it all on our own. So looking at who is in my support network, who are some people in my family or my friends or my coworkers for that, you know, day-to-day support, and where would you go to seek that more professional support? Do you have an employee wellness program? Do you have access to private practice counselors? Mental health and addiction services. So there's looking at, you know, some different levels of support that you can access. In terms of some community groups or organizations, there are several community groups, organizations, self-help groups, and supports available throughout the province. These are just a few examples. You know, for more details in terms of, you know, specific to your area, you can go to bridgethegap.ca for more information, because again, they do have a service directory of services throughout the different regions of our province of Newfoundland and Labrador. So, you know, contact that. 811 also is a great resource to find out what community groups, organizations are out there, as well as the 211 you know, information line. They would have certainly a listing of groups and organizations that provide support and resources to individuals. So, there's lots out there. But like I said, I just wanted to highlight a few in the next couple of slides. So the Canadian Mental Health Association, so CMHA, again, there's offices throughout Newfoundland, main office, of course, being in St. John's. So they have provide a lot of education sessions and resources on mental health. Channel is the Consumer Health Awareness Network of Newfoundland and Labrador. So again, they offer a lot of supports and programming to individuals, peer-led support groups, individuals with lived experiences, and they also provide the Channel Warm Line, which is another mental health support line that you can access. 12-step programs such as Alcoholics Anonymous, Narcotics Anonymous, Gamblers Anonymous, Al-Anon, which is a family group for family members impacted by a loved one's addiction. Alateen is a support group for youth who are struggling with addiction in their family. So there's a number of 12-step programs out there as well. YMCA is another great resource in the community. Community youth networks often are partnered with the YMCA. Schizophrenia Society of Newfoundland and Labrador. Family Resource Centers, again, are a great resource for family members. John Howard Society, the AIDS Committee of Newfoundland and Labrador. Also, not forgetting our schools, guidance counselors, looking at colleges and universities as well. So, we say schools, but it's more than just your elementary and primary and junior and high school. It's also our colleges and universities also provide a lot of supports and resources for students. The Department of Child, Senior and Social Development, CSSD, also provides a lot of support to individuals, family justice services, victim services, various religious groups or organizations. Oftentimes that's a person's first go-to is, talking to your elder or your clergy member. Various women's centers, can provide a lot of supports to individuals. So again, this is just some common examples of some community groups and organizations. There are many more out there throughout the province. I just wanted to highlight some of them. Within the Corner Brook area, we have Community Mental Health Initiative as well, Violence Prevention West. So we do have a number of programs as well. I also want to highlight some of the crisis and helpline information and numbers. So we have our mental health crisis line, and the number is 1-888-737-4668. This is a 24-hour crisis helpline that's free and it's confidential to individuals, family, and friends. If you feel like you're unable to cope or are thinking about suicide, or if you're not sure where to turn for help, you can contact the mental health crisis line. Also, our Newfoundland and Labrador Health Line 811 number is again a confidential 24-hour telephone line staffed by registered nurses in our province who can offer health advice, information, and connect you with resources and local services. We do also have a crisis text line, and that's where you text TALK to 686868. And this, again, is for children, youth, and young adults who can now text a trained volunteer crisis responder who will help with any issues, big or small. Again, this is confidential, free, and available 24/7. The Kids Help Phone. So the crisis text line is a branch of the Kids Help Phone. So Kids Help Phone is 1-800-668-6868. And this is free telephone and texting support to children and youth 24 hours a day, 7 days a week in French and English. Youth can be anonymous and will receive professional counseling, information, and referrals. The Channel Warm Line, so I mentioned the Channel program earlier, so they have a warm line, 1-855 753-2560. This is a non-emergency, non-crisis telephone support and referral service. People with lived experience receive training to operate the service. Our Newfoundland and Labrador support and info line is 211. And this is an information and referral service that connects Newfoundlanders and Labradorians to critical human, social, community, and government supports. The service is available in 170 different languages, 24/7, every day of the year, and is 100% free and confidential to all service users. The sexual assault crisis and prevention line is 1-800-726-2743. And this again is a 24-hour, 7-day-a-week support and information line if you have been impacted by sexual violence. We also have the Smokers Helpline, which I skipped, 1-800-363-5864. And this is a free confidential service providing information, resources, advice, support, and motivational counseling while you are working towards being smoke-free. They also have a connection to a text message support program where you can receive a text per day for 12 weeks. We also have the First Nations and Inuit Hope for Wellness line, 1-855-242-3310. There's also a Provincial Transition House Crisis line, 1-877-753-1492. And this support is available to women experiencing domestic violence. The Recovery Centre, again, is located in St. John's. It is open to anyone in the province who is 16 years and older who needs help while withdrawing from alcohol, drugs, and/or gambling. They now have around-the-clock nursing support and can provide medication to help your withdrawals as needed. Once you start to feel better, there's a counselor and you have meetings that will support you as you begin your recovery journey. The Trans Lifeline is 1-877-330-6366. And this provides trans peer support for our community that's been divested from police since day one. We're run by and for trans people. The 2SL GBTQIA plus warm line is 1-866-230-8041. And this is a peer support service for the community in Newfoundland and Labrador. If you need someone to talk to, call, and we will do our best to support you and provide you with resources. The StreetWorks Access Program is SWAP, located in Corner Brook. And this service, it's 1709-634-3335. And this is a needle distribution service offered by the AIDS Committee of Newfoundland and Labrador. It is a health promotion and education service for people who use substances. There's also a gambling helpline that is free and confidential, available province-wide 24 hours a day. If you or a family member has a gambling concern, please call us for more information and support. So it's 1-888-899-4357. And Crisis Service Canada is a suicide prevention line as well. So that is 1-833-456-4566. All right, so that brings us to the end of this session, and I just want to recap a couple of things. Again, you know, there's so many programs and services, community groups, organizations, and supports out there for all of us. It is important to be aware of what is out there and how to reach out. Just note that the programs and services discussed in this session may not include all that is available because, again, there's so much out there. So it's, you know, this is just a overview of some of the things that are available. And I like to just read this quote on the bottom: and never be afraid to help others in their time of need. You never know when you may need that shoulder to lean on. So I like that quote. So again, my name is Charlene Payne, and I'd like to thank you all for joining in this session today. I hope you've taken something and learned a little bit more about some programs and resources that are available in your community. We're all struggling during this time and living in a pandemic. It's very challenging for all of us. But remember, it is okay to ask for help. It's not a sign of weakness. It's actually, I see it as a sign of strength, to be able to ask for help. We don't have to do it all alone and on our own. We have to remember that we are all in this together. So be kind, take care of yourselves, take care of each other. And again, I want to thank you for joining and have a wonderful day. Take care.